I'm your host, David Temple. We are here at the Venetian Palazzo in Las Vegas, and we are celebrating 30 years of Sirona in a motif of rock and roll music. That's what I was digging about the morning show. We're talking about the Orsiphos SL3D, among other things. I want to start off there, then I want to come back around what we saw this morning. But let's start off with the Orsiphos and talk about that. Jorg, would you like to kind of hit things up for us?
Yeah, okay. It's great to be here, actually. I'm from Germany, and we developed that product the last 3 years, I would say, actually. And it's our newest family member in the extraoral family for the X-ray units. And, well, we had really tough times to think about how can we improve that two-dimensional technique which is out there for decades. And what we built in that new product is astonishing image quality. We have developed a unique sensor, which is called direct conversion sensor, which, well, at the end of the day, produces the best panoramic images which are out there in the world, actually. Yeah, it also does three-dimensional images, so like a cone beam does. So we have a new image volume size. Field of view is going up to 11 by 10 centimeters, which is a real cool improvement. So the image covers more of the anatomy of the patient. I think, Tarun, you had a possibility to try it out.
So what I think about the SL, the great thing is the field of view. And the important part of the field of view is it's not that you lose the smaller field of views, it just adds another field of view. So you maintain the 5.5 field of view, you get the 8 by 8 field of view, now you get 11 by 10. And the big things that I've seen with 11 by 10 is we'll always get the third molars. So if you're doing third molar surgery, you'll always get that. And you'll get more of the sinus. So if you're doing larger cases, you have more diagnostic capabilities in the sinus. But the big thing, the real big thing with 11 by 10 is the airway. And I think being able to get the airway and being able to be able to properly communicate with patients, the airway is a fantastic addition to the family.
What else did we do? That's on the imaging side of the product itself, actually. But if you look at panoramic images, how they are done in a dental office, it's a little bit cumbersome technology. You have to really know what to do, etc. So ease of use is, with those products, really a key issue. It has to be easy to use so that it's really not disturbing the workflows you have in your dental office. Mm-hmm. And this is what we concentrated as a second aspect in the development. We really had a redesign of some components of the machine. So we have a new EasyPad, which is the user interface. You work with the machine. We have an auto positioner. Positioning the patient correctly in that machine is crucial regarding the image quality. And it's complicated in old machines. And what we did is to have that completely automatical. So the patient stands in, he bites on the bite block, and the machine tells the operator if it's okay or if it's not okay. And that leads to the best images which are out there.
That's great. You know, I'm really excited about the panoramic aspect. And it's kind of funny because it doesn't seem that cool. But what I missed about my XG3D going to the Comfort Plus was the ability to take that 2D pan. Because what I'd find was I would diagnose my cases, I'd place my implants, and if I did a full mouth case with maybe 12 implants, right, I had to take 12 little PAs. Because if I took a cone beam scan, again, there's more radiation dose and also sort of metal scatter as well. So having that ability to have that pan is huge. Yeah, so I'm excited about that.
And the other thing on the Panorex is I'm a big proponent of 3D imaging, huge proponent of 3D imaging, but sometimes you miss that 2D imaging in the sense that you have children in your practice or you have cancer patients in your practice and you need that quick diagnostic X-ray, and the 2D pan certainly fits that bill. And the image quality and what we're seeing with the sharp layer technology, the images are the best I've ever seen on any Panorex. I mean, by far, the absolute best I've seen. So we're really enjoying that Pano feature as well.
Do we have the extraoral bite wing option like we had in the XG, or is that eliminated?
No. Of course, it's in there. And it's really a cool combination together with the new sensor, because the new sensor brings more resolution than the old ones. Mm-hmm. And that's really hot. So you have to figure that out.
Yeah. When you take a 2D pan, you go back into the 2D pan and can adjust the image. If the pan was taken the wrong way or mispositioned, you can realign the patient, which was never possible before on a 2D image.
Wow.
So that's a great possibility. And as Jörg mentioned, the automatic positioning, I mean, absolutely makes the process of positioning patients so much easier. So you get consistent images all the time, and it just reduces the stress on the operator as well. When they're taking the image, it just makes the process very seamless.
Yeah, I remember when I used to have a pan many years ago, I would get image with a reverse smile and different things like that. And you try to teach somebody, your new team member, and you try to teach them, the pan needs to be at this angle. Now when the patient bites and the machine just says, in fact, it doesn't tell you where to move. You just press the button and it stops moving when you get to the optimal position. Yep. So it's really foolproof. It's actually quite amazing for team members.
Mm-hmm. Yeah. We've got a good slogan, 2D is the new 3D.
I'm sitting here thinking about celebrating 30 years, and I'm thinking to myself, can you guys, the specialists, imagine going back 30 years, knowing what you know now, how archaic some of the technology?
Oh, yeah.
I mean, it's just crazy, isn't it?
It's freaky.
Not even 30 years. If you just go back 5 or 6 years even, how much improvement and where we've gotten to with the integration. I mean, one of the things we haven't talked about is the integration with the SL. Is that we have this? We can maintain the CEREC integration. We maintain the new airway integration, so we can still do our implant planning. We can do our surgical guide creation. We can have all those great features that we've come to love from the Sirona family. So all those things are there.
And as we said in an earlier forum, can you imagine what it will be like 30 years from now?
I'm scared to imagine.
I can do dentistry in my pajamas with a little robot working on my patients or something like that. Back to what you said, though, about 30 years ago, I mean, I do a lot of endo, as does T-Bone, and having this sharp layer technology is going to be huge so we can look at canals better. What's the minimum voxel size? It's 100?
80 microns.
80 microns.
Yeah.
That is unreal. So those that aren't familiar with voxel size, it's the lowest resolution. And what I kind of like to think about is I think about it in terms of K-files. Mm-hmm. So K-files have the ISO standardization system. So a 10 file is 100 microns at the tip. So we typically have been resolving down to a 10 file. So if I'm looking for MB2s and now I can take it down to an 8 file, that's pretty unreal. But from the diagnostic capabilities of endo are just awesome. I mean, so many times I've looked at teeth, lot pain, and I'm like, eeny, meeny, miny, mo, which one needs the endo? We can see it so well now with cone beam.
Yeah. And August, you mentioned in some of your lectures in the past about the metal artifact reduction.
Yeah.
Where we have come, and you have experienced some of that as well with the XG3D. Maybe you can talk about a little bit about that.
Absolutely. I mean, gutta percha, zirconia, posts, and whatnot can really obscure diagnosing why endo is failing. And that's one of the reasons why we want to buy it. Now all that artifact is gone, and I can see extra canals. I can see, ovoid canals that weren't instrumented properly. I mean, it was guesswork before with X-rays, angling X-rays. Again, eeny, meeny, miny, mo sometimes.
Well, even beyond the eeny, meeny, miny, mo, you can pick and choose which root canals you do.
That's right.
For example, if you find a molar that has 5 or 6 canals, it may not, as an insurance provider, it may not make sense for me to do a 6-canal molar because my reimbursement doesn't get any better. So I may choose not to do a case in that sense.
I just pull it to an endo implant.
And August, when the patient is in the chair, do you actually do the eeny, meeny, miny, mo?
I do.
Yeah.
My lips move a little bit and I don't talk, and then I just go, hey, what the hell? Let's do this one.
He's got strings holding him just doing this.
No, you tell him. You're like, it could be multiple teeth, so we're going to start with this one and just keep going down the line.
Right.
I mean, look, if I have my house payment or something that month, I tend to do more.
Tarun, maybe you could talk a little bit about, you do a lot of sleep dentistry in your practice, and in what this you need, what the new field of view with the SL will allow you to do, and what we're also previewing here at C30, the CCAT Air software, and where do you see the potential of that software for you?
Well, I think first we need to recognize that sleep apnea is a major problem in this country. I mean, we're getting bigger. I mean, look at me. We're getting bigger. We're all having airway breathing issues. So we as dentists are a first-line defense for our patients to be able to diagnose and better treatment and cure, get our patients into treatment for sleep apnea. So one of the requirements for me in my practice is having a cone beam machine that can capture the airway. So that's what the SL does. It makes sure that we are able to capture the airway. Now, diagnostically, with the CCAT Air software, we're going to be able to actually measure the volume of the airway space, and then be able to take a post-operative scan and measure the new volume of space with appliance therapy in place. So we're now able to really not just diagnose better, but we're able to visually communicate with our patients better, and the combination of those two increase case acceptance and patient awareness, and that's the name of the game.
Very cool.
So, Jorg, as we start to wrap it up, what would be some of your closing comments or thoughts?
For the Autofos SL, I would say that's the best pan machine we have out there in the world. And according to my opinion, it's also the last big improvement we see on pan technology. You just ask about 30 years ago and what is going to be in 30 years. In 30 years, we're going to have 3D and only 3D, because that's the technology of the future, actually. And we will see all the big improvements are going to be on 3D, actually. So like airway we have. But this Autofos SL machine is the best we could develop in panoramic, and it's really a great machine. It has best image quality. It has an outstanding sensor inside technology inside. It's based actually on a proven platform. It's an Autofos. We created 100,000 Autofos in the last decades, so we know what we are doing. That's really a reliable unit. And of course, it's integrated. So we have software packages with it. We just mentioned implant, we mentioned airway, but it also integrates with the practice management, etc., and so on. So we try to set up a product which really integrates in the practice and also in the workflows, and doesn't disturb, and does help to concentrate on the treatments and the patient care.
And it's beautiful, by the way, and the LED lights and how it looks to your patients and the presentation.
I was going to ask you, how has that been in the past?
I think one of the things sometimes we don't give enough credit to is how something looks. And when your patient, maybe they're not getting a scan today or an x-ray today, but when they walk by it and they see something that's so aesthetically pleasing, and it looks very modern, and it has the lights and the glow behind it. I mean, it just has that beautiful look that I'm in the right place. And that's what we're really trying to do for our patients, is make sure that they know that they're in the right place.
Do they change the colors? You can make it look like you're at a rave or something like that?
Yeah, you could have a discotheque or the whole deal.
That's
nice.
Right, you know, little nitrous balloons. Yeah, great, cool.
Presentations, everything.
Image is everything. I think Andre Agassi coined that, right?
Yep, exactly. Gentlemen, thank you for your time. Really appreciate it.
Yeah,
nice stuff. We're going to take another short break and be back live here in Las Vegas with more Sirona and celebrating 30 years, CEREC 30, live from Vegas.
Woo.